Hi, I am Dr. Dipanjan Panda. I am a senior consultant and academic advisor in the Department of Medical Oncology at Indraprastha Apollo Hospital, New Delhi. Let's talk about lung cancer today. Why lung cancer? Because lung cancer is not only one of the commonest cancer in India and the world today, but it is also one of the most fatal malignancy. However, it is also one of the preventable cancer and detected early, it is curable. Let's talk lung cancer. What are the signs and symptoms of lung cancer? Well, there is no one size fit all, but some of the common early warning signs of lung cancers are chronic persistent cough lasting more than 2 weeks, cough with hemoptysis, that is coughing of blood or a rusty sputum, wheeze and constant weight loss. Well, these all features can be there even without cancer, but if you have got these persistent symptoms, there is a chance that you may have cancer, and you should go to your nearest hospital and see a doctor. How the doctors, especially the oncologist, diagnose cancer? Well, the basic diagnosis has already been done generally when patient comes to us. However, to confirm the patient has cancer and to stage it properly and to treat it, we do a battery of tests. Some of them are basic tests and some are advanced tests. These includes chest X-ray, a CT scan of chest, whole body PET CT scan, bronchoscopy and bronchoscopy-guided biopsy, endobronchial ultrasound and guided biopsy, or a CT guided biopsy. With the help of these investigations, we confirm that patient has got cancer. We also stage them whether they are locally or they have metastasized to other parts of the body, and we also do some precision testing to find what are the subtypes of cancer. Now is the era of precision oncology, so it is not enough to us to know whether the patient has lung cancer or not. We also need to know what subtypes of the cancer is and what molecular mutations are there. So, all these tissue what we get, they are a battery of molecular testing to find out the exact subtypes and if there are any molecular mutations. Once the cancer is diagnosed, then the treatment part comes. It is heartening to know that detected early, cancer is treatable and curable. Most of the early stage cancer can be completely curable by surgery. If they are locally advanced, they can still be curable with definitive chemoradiation. For an advanced and metastatic disease, we now use chemotherapy and targeted therapy and immunotherapy to give the patient a long disease controlled and productive life. Many people ask us what are targeted therapy and immunotherapies. Well, targeted therapy are treatment which targets any particular mutations in the cancer cells. If the lung cancer patients have mutations like epidermal growth factor receptor or ALK receptors, we have specific treatment which is in fact oral tablets which can control the disease for long time. For patients who are not fit for targeted therapy, we can also use immunotherapy or immune checkpoint inhibitors. Immune checkpoint inhibitors are a class of drugs which stimulates our body's own immune system so that they can fight and control cancer cells. The best thing about immune checkpoint inhibitors, because they stimulate body's immune system including the memory T cells, so their effect can be long lasting, and in fact the body's immune system can still work and fight against cancer long after you have stopped the treatment. Altogether, in a nutshell, lung cancer, although is definitely a serious disease, detected early, it is completely curable. Surgery, radiation therapy, chemotherapy, immunotherapy and targeted therapy are some of the treatment options we have. In India today, we have got all the advanced treatment options for treating lung cancers, and these treatment options are available to your nearest hospital, including government hospital. So, if you have a symptoms which is suggestive of cancers like cough, hemoptysis, weight loss, do not be afraid. Go to your nearest hospital and show to a doctor. In the end, I would like to say to all my friends that about cancer, be aware, be alert, but please never ever be afraid. Thank you.